am Dr. Vijayakumar Narayanan. I did my basic medical graduation from Kerala, South India. So, talking about cancer, see, being worked in different countries, there was no limit of resources. Say, for example, Singapore and all, the entire treatment is vertically sponsored, where the patient is not bearing the cost of the treatment. Working in a resource limited country or scanty resource country like Kenya is very challenging. In fact, we are sitting on a hot seat. Every day is very challenging for us. Patients are sitting in front of us. They don't have money even to buy a single pain tablet. In the recent years, maybe a couple of years back, the National Hospital Insurance Fund has come up in a large manner in Kenya. And now at least some kind of treatment is bearable to many of the patients, at least some. But still, the cancer treatment, the cost of the treatment is prohibitively high in countries like Kenya and all. Reasons are many. One, see, if you can identify a cancer in an early stage, most of the cancers are curable. Say, for example, stage 1 or stage 2. But unfortunately here, we are getting cases in a fairly advanced stage, stage 3 and 4. When the stage advances, the treatment cost also escalates. That is one problem. Secondly, the medicine, the cost of the medicines, drugs are priced very high here because there is no manufacturing happens in Kenya. All the drugs are either imported or they buy it from other countries by themselves. That is very few, but we get the medicines mostly for importing from other countries, and mostly the drugs are coming from India. In India, the generic drugs are available, and the originals are still very high, and that is not accessible for the poor people of the country. So that's the second reason. And the third reason is the ignorance of the people. They are not much aware of the cancer and all. Just like, see, the problem with the healthcare system in Kenya, I'm not blaming all, but a few things I have to point out. You see, the system is not very well functional. We need to have a proper referral system. So, for example, if a patient is coming with a lump in their breast, the first suspicion is breast cancer. When we were all medical students, years back, maybe in the late 80s or early 90s and all, cancer was a diagnosis that is coming as an exclusion. We exclude all other possibilities and finally we will jump onto the diagnosis of cancer. But the situation is different now. Now the cancer is the first diagnosis, all other diseases are coming as exclusions and all. So unfortunately what happens is here, for one simple example I tell you, is a lung cancer. Most of the lung cancer patients are being treated as tuberculosis here by people who do not know much about the cancer and all. By the time they come to us with a proper diagnosis or a suspicion of the cancer in the lung, it might have gone to other parts of the body like the bones or the brain or to the liver or any other organ. It becomes stage 4. So the ignorance of the people, that is another this thing, and the lack of proper healthcare system. The proper healthcare system and referral system is lacking. These are some of the reasons where the cost of the treatment is very high. But in the recent years, the last 1 decade or so, the cancer services has been constantly improving in Kenya. When I started in 2011, we had only two linear accelerator in the country. Now we have around 12 or 13 linear accelerators. Some are yet to be started, but they are in pipeline. And there is a PET scan machine is coming up in the Jammu Kenyatta Referral Teaching University Hospital. So things are improving. I should say that things are improving. There is some light in the tunnel. It is not all dark, but we have miles to go. When we compare our results with the other countries and all, see, if we get a case fairly in an early stage case, our results are at par with even the Western countries. Thank you for joining with me for this discussion on cancer, especially the breast cancer and prostate cancer. I'm an oncologist, and you can book my services through ponea.com, and ponea.com is a wonderful service provider for different specialties of medicine, and you can access my oncology services through ponea.com. Thank you very much.